It's probably safe to say we all know someone who's battled cancer, but the impact is even closer. 1 out of 3 of us will be diagnosed with cancer in our lifetime. And while genetics play a role for some, in tonight's Health News to Use, we get a doctor's prescription for strategies to help cut your risk of cancer dramatically. Change your lifestyle, and up to 80% of cancer cases may be prevented, says the National Institutes of Health. First, stop smoking. It's the #1 cause of lung cancer.
If you're smoking, stop. If you're not smoking, don't start. And don't start vaping. Don't start those things that you inhale that are, from outside.
Dr. Kevin Tulipana, Vice Chief of Staff at Cancer Treatment Centers of America in Tulsa, prescribes maintain a healthy weight because he warns obesity is about to become the primary risk for cancer.
And that's pretty frightening, considering the obesity epidemic in the United States.
Avoid sun exposure and sunburns, especially in children. Enjoy alcohol in moderation, 1 drink per day for women.
So that's 1 4-ounce glass of wine. For men, it's 2 beers or less a day.
Dr. Tulipana also recommends screening tests for cancer. Talk with your doctor about your risk and the best timing to be tested. For most women, Pap smears are recommended at 21 and mammograms for breast cancer around 40. For men, there's prostate cancer screening. And Dr. Tulipana recommends everyone get a colonoscopy at 50 to detect colon cancer. He says lung cancer screening is one of the most overlooked and underutilized tests available, especially for smokers over 55.
Lung cancer is highly, carries a very high mortality rate. And if you can find those cancers really early, you can dramatically improve that mortality rate.
And don't forget to have your doctor check you over for skin cancer during your annual physical.
Because many of those melanomas show up in places that we can't see, on the back of your legs, on your feet, and your loved ones may not even notice those.
Now, Dr. Tulipana says there have been changes in recommendations for various screening tests in recent years, so be sure to talk with your doctor about what's best for you, keeping in mind your family history.